I'm joined now by Dr. Raphael Olaiya, an NHS doctor. Dr. Olaiya, thank you for joining me. Now, are you surprised with these findings?
I'm not surprised after hearing what's been in the news and over the last 2 years. I think, first of all, it's mitigating circumstances and extenuating circumstances through the black swan event of COVID, which no one expected and no healthcare system was ready for. So that's the first thing. But hearing that statistic as an NHS doctor, I'm sure anyone that's worked for the NHS is going to be embarrassed by that number. And it's quite abysmal, to be honest. And, the prestige of the NHS, the prestige of the nursing and medicine training and education system and all the colleges, to see that figure, it gives us a message that something serious needs to be done about it. And, as a matter of urgency, if that number of people, 74% are unhappy, very dissatisfied with the NHS. But what can we do about it? That's the question.
That's a good question, because you know what, before the pandemic, because I know the pandemic obviously showed a lot of the gaps, but actually I think the NHS did actually come up and perform as required and did a good job. But before that, these failings were apparent. Where do you believe the biggest failings are?
What I believe the biggest failings are? I think as an NHS doctor, I'd say, we should ask how can we improve it. That's how I'd like to, have my input on this. And first of all, I'd say, I think it starts with the staff well-being. I think the other big companies in the world, highly respected companies that are doing well, whether publicly funded or private, they take a keen interest in making sure the staff, regardless of the level of the staff, senior or junior, they make sure that their well-being is high. And of course, well-being is a big word, and it can mean many different things to many different people. And, that could be with the pay, that could be with the nutrition, that could be with the sleep, but staff well-being, and which has effects on the morale and how well they can do their job, especially when it comes to healthcare. If any industry should know, then of course it's healthcare. That's the first thing. Secondly, it's the technology interoperability. The data and the technology in NHS, a lot of it is quite disjointed. And if there was better communication between it, different healthcare, smaller systems could communicate better. That's the second one. So the third one is, I think, the performance indicators and the performance incentives from the top level of management all the way down to the clinical shop floor level. The incentives should be there, and they should be clear, because if someone's going to be a really good doctor or a really good nurse, they should be rewarded for it. And sometimes they can be a really wide spectrum.
Well, listen.